Okay, so let's move into the antibody testing. Um, how many employees have tested positive? We were all looking forward to this testing with,
Yeah.
great expectations, and it's been a little lower than we expected. So how many have we tested, and how many have tested positive?
Okay, so this is as of Tuesday, so just a couple days ago. We've tested 1,910 employees, residents, physicians. So we have roughly 5,000 employees, roughly 700 providers. We've invited all of them to be tested, but again, it's not mandatory, and some folks have decided just not, they just don't want to be tested. So, but 1,910 have been tested, and 58 of them have tested positive for evidence of the antibodies. So that's about a 3% positivity rate. I know one of the questions I had asked is I was surprised it was so low when we first started testing, because we first started testing just those employees and providers that had had the greatest exposure to COVID patients. Those that work on 2 South or in the ICU or in the emergency department. Those that we were most concerned with. We certainly were equipping them with all the personal protective equipment and everything, but you're still at greater risk than you and me.
Right.
So I had expected that we would have a much higher, positive antibody result in them, and that hasn't turned out to be the case. The 100 or so employees that
Right.
tested positive for the antigen. So we did the nasal pharyngeal swab. They tested positive. We know they had the virus. Did we test them now for the antibodies to see that they were there? We have tested, a number of them, and I believe there actually were eight of the 1,900 that that had tested positive for COVID, but have tested negative for the antibody. Yeah. So now we have our epidemiologists and folks that are studying that outcome and then saying, okay, did we have a false positive on the COVID test? Maybe they weren't infected. Or did we have a false negative on the antibody test, meaning that they do have the antibodies, but it didn't detect them. So that's one of the the questions is, when you get the virus, does it always? Are you guaranteed that you're going to develop antibodies, or
Right. Right.
what level of antibodies do you have to have in order for it to show positive, or how long do the antibodies stay in your system?
Right.
Are some antibodies permanent, or do some, you get the antibody and then after a half a year, it disappears and you have to get sick again to build new antibodies? I don't know. So that, again, is one of the puzzling things.
Right.
But then there are a lot of employees that did test positive for the virus that said, why get the antibody test? I know I had it. So why should I get the blood test? What's
Just
it?
for
Just
the knowledge.
I
Just
know
for the
exactly.
sheer
Yep,
knowledge. Yes.
you did have it,
Yeah.
and what I like about it, and I haven't had a chance to get mine done yet, and I'm fully expecting it to come back negative. But with this particular antibody testing we're doing on the chemical analyzer, we actually give you a number too. We can tell you just how strong the antibody is in your system, versus you show some nominal measure of antibodies,
Right.
versus man, you've got it really, it's heavy in your
Right.
system. Because you might think then, well, good, if I've got really strong antibodies, I'm more likely to be immune or have some immunity than if I just had a small amount of the antibodies. So,
Right.
but we'll continue testing,
Mhm.
and I'm still thinking it's probably a couple weeks out before we open it up to the public, because again, this is not a finger prick. This is you going into the lab, sitting down in the chair,
It's a
having
vial.
the
Yeah.
phlebotomist putting, the tourniquet around, drawing a full vial, labeling. So there's a lot of labor
Right.
that is involved, and we already have very, very busy labs that are taking
Right.
care of people. So just making those phlebotomy services available, we're just kind of working through the logistics of that. But we would love to do much more widespread testing.
Right.